My objectives for this are to understand why this is important for us to be talking about. Why did we gather all these people together? And I want to make sure everybody has a pretty firm understanding of grief and loss and bereavement just in general, because it's a good place to start. And then we'll talk about identifying grief reactions, because sometimes they are pretty delayed or aggressive or odd behaviors, and then understand that they are a grief reaction once they've been identified, and then figuring out how to help process, how to help. And that one I have kind of layers of ideas, not just for the individuals with the developmental disabilities, but for the agencies, for the people working with the individuals. So I hope I'm going to hit a lot of what you all were presenting out there as far as your wishes and your experiences. So the first one, why we're addressing this, and why it's important. They're living longer. The research says that with all the, well, not research, with all the medical advances that we've had, we're giving better medical care to all of us, every human being. And with that comes longer life. And in fact, the research shows that people with developmental disabilities are living near normal lifespans, and even the people with Down syndrome live well into midlife, which was not the case many, many years ago now. And it's just the education we have of how to take better care of ourselves has led to people living longer. And with that, we're facing that they're in communities for longer time periods. They're outliving their parents and family members. They're outliving friends, people who they've created meaningful attachments with throughout their lifetime. And so we need to be looking at this and figuring out how to think ahead. Think about, okay, this is going to happen. This is part of life. And what can we do to help with that? So you're important. And I feel like the people in this room are the ones who will be, in a sense, on the front line of helping. And that's why I wanted to do this when Doris asked me to, because oh good, people are actually going to be able to do something. It's not just a class where I'm teaching people who may never work with a developmentally disabled person, but people who are already in the field and have some ability to make a difference. Creating meaningful attachments. We live longer, we have more and more people who mean something to us, who are important, and attachment is loss, really. I mean, it's a really sad way of thinking about it, but it's the truth. Anytime we allow ourselves to be close to somebody, we are risking pain, because eventually it will change and there will be a loss. I read an article, I have 3 teenage boys, and I read an article that when your teenager has their first love, be prepared, because that'll be their first loss. So that kind of puts it in perspective. Okay, so we do this. This is life. This is what we do. We kind of go through life knowing that we're going to lose. And it's something that we need to be prepared for. And I do feel like it's an area that is lacking with this group of people, because it's so hard. It's hard to talk about. It's hard to look at. It's hard to our society says don't talk about it. Just move on. And so add the extra layer of the population you're working with, and it's just almost easier not to. So that's why I think it's important to do. I think that it's part of life, and we're going to need to help them understand that and process it in a way that's healthy. So let's look at what grief is. It's a normal response to a loss. I guess the biggest name in grief and loss is Kubler-Ross. I don't know if that's a familiar name to you. She looked at death and dying and determined that there were 5 stages to the process. And then those stages of death and dying got kind of attached to our grief process. And so let me go over those and just go through them a little bit. Denial, first stage, no, this isn't happening. Or it didn't really happen if we're talking about a loss that's already happened. Or it doesn't feel real, or I refuse to believe it. Kind of forcing it away, not thinking about it. Anger, very natural, very normal reaction. To be angry that it's happened, to be angry at the person who's dying, to be angry at God, to be angry that you couldn't do something about it. I mean, anger definitely goes with the process. There's no question about that. Bargaining, this one I think of more as when you're actually facing somebody who is dying, or your own death that's coming. This sense of, well, if I can beat this cancer, I will never smoke again. I mean, it's a bargain. You're bargaining. You're trying to, if this, then this. If I get what I want, which is not to feel this pain, then I'll do this. And we tend to attach that to our grief process as well. Depression is most definitely a piece. It doesn't always go to the place where a clinician would consider it clinical depression, but all the components will be there. It's part of the process. The sadness, the lack of energy, fatigue, not being able to think clearly, the kind of hopelessness, helplessness, like what's the point? It's natural process, part of this grief process. And then the last one is acceptance, where you find a way to accept that this has happened, this is what life is, this is where I'm at. And so an important piece to remember about grief and these 5 stages is that they don't happen in any particular order. We don't experience all of them. Like if you miss one, it doesn't mean you're doing it wrong. But they tend to happen at different times and different timelines, depending on who you are and what the situation is, how you deal with grief and how you process things. But it's just something to keep in mind as we talk today about what your clients are going through and your children, and they're going to be experiencing all these things as well. What came many years later, I think not until like the early 90s, was a kind of a little different idea about grief, and it's the tasks of mourning. And this was William Worden who came up with this. Because the 5 stages don't come in any particular order and they're so different from person to person, he started looking at, well, what are people doing and how are they mourning? And so he came up with the fact that there are 4 tasks. One is the ability to accept the reality of the loss. So, the very first task is to yes, this is happening, this has happened. I have lost this loved one in my life, and they're no longer with me. So that kind of goes with the denial piece, where it's not having the denial, getting to that place where it's accepted. Experiencing the pain of the grief. This is an actual very important piece to mourning and grieving, because if we don't feel the awful feelings, unfortunately, we get stuck. And we really need to get through all the tasks in order to have a healthy outcome, in a sense. So experiencing the pain, and instead of what people do a lot of, doing the distractions, working extra hard, finding something more important to deal with, because it's keeping busy. All those are just kind of a Band-Aid that don't fix it and will actually prolong the grief, because you really do have to allow yourself to feel the pain in order for it to stop happening. Another task is the adjustment to the environment in which the loved one is missing now. This person isn't here anymore. This person isn't, sitting at my breakfast table, they always sat right there. It's sometimes very, very, there's nothing you can do to avoid this one. It is just what it is. And this is definitely one of the tasks that you have to work through, and of course it's going to make you experience the pain of the grief as you accept that they're not there anymore. So they go hand in hand. I'm not sure these are exactly in any order either, but they tend to be a little bit more of an order than the 5 stages theory. So, and after you've accepted that they're missing from your environment, the next and final task is to stop putting the emotional energy into not experiencing life, and actually reinvesting in life. So this takes a while to get here, but this is when I had a client tell me once, I love this, I've used it over and over and over again. I don't remember if I got her permission to, but it's the new normal, is the way she put it, this last stage. This is my new normal. Yeah. Okay, you've accepted that this is life now. My loved one is missing. I hopefully am not experiencing the intensity of the grief as I was. And therefore, I feel safe enough to start reaching out, making new attachments, putting some energy into new relationships, and my new normal. And I just have loved that ever since. I think it puts it in, that makes sense. We do that all the time with little things. I know we're talking about death, but we're going to talk about the other losses too, that are, little, but they're not. But again, nothing compares to the death. In order to help somebody with their loss, you need to understand yourself and your loss. You need to know. What do you need to know? You need to know what your experience is, be real clear. And it's not just loss with death. Keep in mind that loss is also, you changed schools in high school and lost all your group of friends and had to start over. That was a loss experience. And so with that in mind, you need to ask yourself, what's my response to loss or grief? How do I respond? Am I the keep busy, just plow through, stiff upper lip, or do I cry for days and weeks? Do I tell everybody what's going on? Do I hold it all in? We're all different. And so kind of need to look at yourself and figure out, what do I do? What's natural? What have I done in the past? How do you cope? I think that's where the talking sometimes is some people's coping techniques, the quiet time to yourself, going to support groups, the art. There's so many ways to cope. We could do a whole seminar on that too. So kind of look at yourself and figure out, how do I cope? How do I get through the losses that life presents? And then the other question is, when you've been faced with seeing somebody else go through a loss, what did you do? How did you help them? Do you try to distract them and say, let's go do something fun? Are you able to sit with it and let them be sad? That's so hard. So think about that as we go through today too, because that will color how you go back and do your job and how you take these tools with you. And there's no wrong way, I'm going to tell you that. There's no wrong way. But just knowing more about yourself will help you do it in a more comfortable manner. So you'll be able to recognize, I just tried to talk them out of feeling their feeling. I did it again. Okay, I can't do that next time. If that's what you do, which most of us do on some level, because it's hard. Loss of a loved one is life's most stressful event, and it can cause an emotional crisis. There's a list of the most stressful events in a human's lifetime. This is number 1. I don't have them memorized, but I know taxes are in there, which I don't know why, but they're in there apparently. Divorce, marriage, and moving. Those are the 5 I know. There's probably I know the order, but this is number 1. So that's why we're a little heavily focused on this piece here. But with that in mind, how does that affect developmentally disabled? I think it might impact them more if there's a death, because they've been more dependent on their loved ones for a longer time period. I mean, we were all dependent on somebody at one point, but we were given the opportunity to become independent and rely on ourselves, whereas somebody who's developmentally disabled, to varying degrees, will not have that opportunity. Therefore, how much would that impact them to all of a sudden lose this person who has always been there and always helped them? So another piece to keep in mind as we talk about this and go through this is, and I just love that picture, such a connection there. So we're going to talk a little bit about not a little bit, we're going to talk about the specific to developmentally disabled. There was a time when the thought was that developmentally disabled people did not make attachments. And I can guess anybody in this room goes, what? How could anybody ever have thought that? But it was what the thought was. And the logic from that was, if they don't make attachments, they don't feel grief, because attachment equals loss. Research has shown that they suffer loss just like all of us. And it might even be more complicated because of the tasks of mourning and the cognitive, intellectual communication piece of all that. So with that research, the loss of their caregivers or parents, people they've relied on all their lives. And keep in mind, it's not necessarily loss due to death, which we've talked about already. It's their caretakers changing jobs, or getting fired, leaving, doesn't matter how. They're no longer there, they're missing in their life now. So that's specific to developmentally disabled, that they were dependent upon these people in their lives and very much attached. Loss of friends. I feel like they have, we all have loss of friends, right? But we don't lose them they move to a different care facility because somebody in their life decided that was better for them. And maybe we weren't prepared for that. Where'd they go? Why? I don't understand. I'm here. After they experience the death of a parent or a caregiver, they might have to change where they live. Very often, they have to change where they live. And with that, they are having to do one of the top stressors in our life, which is moving. And when they move, not only is the event stressful because moving is stressful, but they lose possibly their friends, neighbors. Maybe they had a job that they will now lose. Their home, the routines will change. Basically, everything changes. And that's a lot of layer of loss, over and over. So not only are we talking about a group of people who maybe experience loss or process loss differently than we do because of their communication skills and intellectual abilities, but I think they might have more to cope with than we do. Most of us don't have to move when we lose somebody and change everything. It feels like it, though. So I thought this was an important piece to talk about because, it's really hard to lump everybody under the labels. You learn the labels, right? So developmentally disabled, there's a lot that falls under that. And so when you're trying to help somebody, it's really important to look at not just the label, but who is this person? This is a diverse population. So who am I really working with in this instant? Who am I sitting with right now? And so keep in mind, what do you know about who you're working with? What type of disability is it? Is it physical, mental, emotional, all of the above, combinations of the above? How capable are they? What's their level of cognitive functioning? Are they mild, moderate, severe, profound in their delays? Sometimes I've heard people, and sometimes when I have done the assessment for developmentally delayed individuals, I'll use terminology like, and it's not my favorite way to explain it, but I think people get it when I say, he's functioning at an 8-year-old level. People go, oh, I know an 8-year-old. So that's the piece, I guess one way to look at it is see if you can kind of understand where they're at as far as what they're capable. Because communication skills is really what drives this for most of us, is how much are they able to communicate in that traditional way, using our words. About half of all developmentally disabled people communicate in a different way, or don't have communication, at least that we can understand or know. So that's going to be a pretty big factor in you trying to figure out, how am I going to help this person? You were talking about the boy was able to come and talk to you. I was like, oh, great. Because what if he couldn't? And he was acting like that. That would have been a lot harder for you to figure out where it was coming from. So keeping that in mind when you're trying to figure out how to help is huge. What is their living situation? Do they live at home with their parents? Are they in a group home, assisted living? Are they on their own but have people helping? Exactly how much support is there? And how does their living situation potentially affect how they function in the world? This one, anything. Pay attention to race, ethnicity, social class, where are they coming from culturally? What have they been exposed to? What are their beliefs, which is my next one, their religious affiliation, spirituality. Do they go to church? Do they talk about God? Do they have this understanding of a life after? And if they don't, then you have to value that too. I mean, we're all different. So it's important to know, who am I talking to? Who am I working with? Who am I trying to help? I think that there's no limit to this list of what we're going to, everybody's so different. We all might show things differently. But we're going to figure out how to recognize it. But before we do that, we're going to look at what's normal. Is there such a thing? But there kind of is a normal grief reaction because we all go through it. So, in normal grief, we have all kinds of emotional reactions. We have anger, guilt, anxiety, sadness, loneliness, helplessness. We might feel numbness, despair, overwhelmed, pretty much any emotion you can think of, we feel it when we go through loss. Even the happy ones, but people don't think about that because you have these happy memories. But that's usually slammed down real quick with the pain of, but that's not my life anymore. It's changed. So, normal reactions, lots of feelings. Thoughts, this isn't really happening, or why is this happening? I'm so confused. Preoccupation or obsession with death. I've seen this with a lot of clients where after they've lost somebody, all of a sudden they're starting to worry about who's next. Who am I going to lose next? Am I going to die now? It's normal to have these thoughts and reactions. The sense of presence or feeling like the person is there, that happens a lot. You hear about this and you think, But the truth is, when that person has been there for 30 years of your life and all of a sudden they're not, you're still going to feel like they're there. You'll expect them to walk through the door at 5 o'clock, 5:30. Or so, you're waiting. And so it makes sense that we have this experience. So I can only imagine what that would be like if I didn't have my cognitive tools to be able to tell myself, of course I'm feeling this way. It might be kind of scary to feel like they're there, but I don't see them. So keep that in mind too. Physical reactions, tightness of the chest, tightness of the throat, kind of jumpy, worried, hearing noises, kind of oversensitivity to it, lack of energy, fatigue, dry mouth. This funny feeling in my stomach all the time. This is normal for any of us who go through grief. And it's actually, I think, an excellent way to help somebody who maybe doesn't have the verbal skills to kind of tune them into their body and let them know, yes, that's part of being sad, or that's part of missing somebody, and kind of let them know that there's a connection of what's going on here. Behaviors, a lot of people end up not sleeping or sleeping too much, or their appetite changes, can't really concentrate and focus. I had a friend tell me after my brother died that he saw me just 4 days later or so at a wedding. And he had lost his sister a few years before, and he said, don't worry, the fog brain will lift. Really? That is so good to know, because I rely on this and it's not working. So the absent-minded, I can't focus, I can't get my brain to work. That's normal. Avoiding reminders. Lots of sighing. Oh, it feels good to sigh. That's why we do it when we're hurting. That feels really good. Everybody should do that. Doesn't that feel good? No wonder we do it when we're in pain. Crying. There's research that says crying releases endorphins. Endorphins feel good. So cry. That's normal too. Having dreams about the deceased. Withdrawing. All of these things are just part of the process. Doesn't mean you have to experience all of them. I'm going to just say that again. We're all different. These are just, you know, it's a lot of people experience these things, but it's not necessarily you have to experience all of them to have passed. So, how would this look differently, potentially? Okay, they're going to have changes in sleep patterns. They might sleep extra. They might not want to go to sleep. They might wake up in the middle of the night. Maybe they had a nightmare or dream. Because we dream about the deceased, so why wouldn't they too? So that could be frightening and confusing and interfere with sleep patterns. Change in eating patterns. Keep in mind it's the change in eating patterns. It's not everybody eats less or everybody eats more. Is it different from how you were before? Is it different from what they did before? That's when you know they're processing or something's going on with them as far as grief is concerned. Changes in work productivity. They may feel, I don't know, example might be that they used to be so happy to go to work and just feel so good about it, and now they kind of don't want to go. Or because of that foggy brain thing, they're making mistakes, not doing it as well, something they've done for years and years. So again, look for changes. That's what the key here is, watch for changes. Remember that hollowness in your stomach thing and your body kind of shortness of breath, and okay, so you're gonna hear, my tummy hurts, a headache. You're gonna hear physical ailments, my back hurts, you know, and that's one way to get attention that you need, right? But the truth is, they're probably feeling something physically because that's what grief does. We feel it in our bodies. So that's a sign to pay attention to, especially if it's different than before. How many times did I say that? Personality changes, uncharacteristic aggressive behaviors, but the lying, the avoiding of the telling the truth, that's a change in personality. And when you see a change in personality, you just have to assume something's going on. Something doesn't feel good, and it's going to come out in some way, especially if they don't have the words to say, I am so sad. We've talked about the communication differences and intellectual variety within the population. Let's assume they're functioning at an 8-year-old level. Okay, that's my example. They're very self-centered. All they care about is, you know, what's going on, and they're very myopic. If that's where they're at cognitively, you need to be careful that they don't think that they are the reason the person died, that they didn't love me anymore, so they left, that I did something wrong, and so now they're gone. So you're going to have to be kind of looking for that. You don't have to necessarily plant the seed, but listen for it. Listen, like, do they seem to be talking a lot about something they did bad before Dad died? And does that seem to come in close together in their communication? You might be, don't forget, it might just be because they don't understand that it's not just about them, because of where they're at cognitively. Magical thinking, compulsivity. The example that I thought of was that, somebody sits in the chair that they always sit in and they throw a fit. They never threw a fit before. They just said, "Can I sit in my chair?" Or, but there's this almost like a need to keep things the same. And actually, I think that's where compulsivity comes from for all of us, right? When we feel things are out of control, it's a way to keep things feeling like we're in control. Well, there's research to show that this is a significant reaction to grief within the developmentally disabled. And thinking about that, common sense says, of course it is. Because they don't have control over a lot of things in their lives. So maybe lining those shoes up in a certain way and having to touch each one before you go out for your breakfast feels like they have control. So that's probably going to get worse. Acting out, aggression, tantrums, refusal to do tasks, that, just not behaving well. And we all want to do that when we're mad and hurt. Again, we just don't do it. Not being able to do what they used to be able to do. You used to be able to put your shoes on by yourself. What do you mean you can't do that? Can't do it. And who knows, is that the acting out? Or is that the, I got the foggy brain and I can't remember which foot is which? I mean, we don't know. But it's very common for there to be a regression in their skills. It doesn't mean it will stay forever. It is just a sign that they're grieving. Searching behavior, looking for the loved one compulsively often, this to the point of wandering, disappearing, like where did he go? Anybody seen Joe? Looking, trying to find that person who's missing. The other one is the increase of anxiety, because there's a separation anxiety that will likely come, so it's more anxious. And with the increase of anxiety comes more compulsivity. They go hand in hand. So know that when you're seeing the compulsive behavior, that feeling that you might need to validate is their anxiety. So what not to do? I always like when they tell me what not to do when I go to a seminar, because I get all this good information, but I need to know not to do this or that. So what not to do? Do not shelter and protect them and keep them out of the process of grieving. Do not keep them from the funeral. And thank you for that perfect example and lead into that. Yes, thank you. So don't do that, and we'll talk about how to not to do it, but don't not do it. Don't withhold information. We think we're protecting. We think it's too hard for them to deal with and to understand. But really, withholding information adds to that feeling of not being in control and not having a place to, make it sense to yourself. So go ahead and talk about, wait, that's the other slide. So don't just keep them in the dark. Jumped ahead of myself. Okay. Don't use euphemisms or softened language. Don't say, Grandpa went to sleep. That's a mistake we've learned by helping children who are grieving, is we've used things like Grandpa went to sleep. Well, Grandpa never woke up. Does that mean if I go to sleep, I'm never going to wake up? And then you have a sleep disorder on your hands. So just say it like it is. Don't, he passed away. That's a gentle way. Adults, we all know what that means. That's not a very concrete term. Passed away. That, for somebody who maybe struggles with, it lives in a real concrete type of communication, that doesn't make any sense. What does passed away mean? So you're going to have to avoid how we usually talk about it with people who are able to fill in the blanks. If possible, now I know this is not always possible, if possible, do not make major changes in routines, where they live, their job, for a year after. Give them that time to if possible. And I know it's not a perfect world, we don't always get what we want, but that would be ideal, to not make major changes. Don't rush the grieving process. Now that you're going to go back with all these tools and all this information, you know, this is how we do it. We're going to get this done and taken care of. We're all on a different timeline, and there's no wrong way to grieve. So you're not in control of this. All you're doing is facilitating. And I don't know how many of you are in the position where you have to assess, I know you have to assess their skills and where they're at. Those assessments are tied to their care and their treatment. Don't do assessments when they're grieving because of that loss of skills, the regression. You're going to get a picture that isn't accurate of what they're able to do. And the worrisome part about that is there's actually a term for it. It's called diagnostic overshadowing. Is that when you misinterpret the symptoms of grief and attribute it to the person's disability. So you make the assumption that what I'm seeing is their disability, not their grief. And for example, anger or restlessness, you know, people might just think it's part of their disability when actually it's a normal grief reaction. But if you take that information and go, oh, we need to put a behavior modification program in place and we're going to have them, and you have all these things set in motion when it's just a natural, normal grief reaction, then you're going to add changes to their life in a time when they don't need changes in their life. So I just wanted to really highlight that one because you are in the position of providing that information to people who are helping and caring for and treating them. So worrisome or complex grief reactions, I'll just go through a few that you should be worried about. Aggressive behaviors, persistent, consistent aggressive behaviors, obviously. Not good for anybody who lives with them, not good for themselves. Persistent irritability, I mean, it's one thing for us to have these emotions and to kind of go through this, but for it to be a constant, irritable, angry, snapping, that's a problem. And not talking at all, if they did have the ability previously and then all of a sudden they just stop talking, that's a sign of complex grieving and complicated. Loss of skills, that one you're going to have to look at how much of a loss are we talking about. Were they able to help set the table and feed themselves before and now they just wait? That's a bad sign if it's that severe of a change. This one I've seen. Where's Dad? Where's Dad? And that's all they say. And they used to talk about other things. Where's Dad? Where's Dad? It's kind of that compulsivity, but it's coming out in words, and it's also tied to the searching behavior. So if something like that happens, you need to keep that in mind. Obviously, self-injury, we can't let that be happening, and that's a sign of something severe is going on inside. Searching behavior, absconding, disappearing. They leave the group home, and does anybody know where he went? And well, he's looking for his loved one. He's looking for the place that felt good. He probably, if it's happening, it didn't happen before, you can almost assume it's grief related, and this whole searching behavior is happening. Hoarding behaviors can be a sign of unresolved grief. When you have loss, you don't want to feel that anymore, so you start keeping everything and anything that comes into your life. Again, it fits under that category of compulsivity.